The patient was admitted to Guam Memorial Hospital on September 25th and has not responded to the traditional course of medication for treatment of tuberculosis. Neither the age, sex, or ethnicity of the patient has been released, but the person remains in isolation to prevent the spread of the virus. Drug-resistant cases of tuberculosis are not unheard of on Guam. Gmh spokesman Connor Murphy says they see 2 or 3 such cases each year, many from the outer islands of Micronesia.
Drug-resistant TB is something that's, I wouldn't say is common, but is something that we see a couple times a year. The outer areas of the region have a lot more cases of TB than we do, and they're identified by the WHO as having higher levels of this drug-resistant TB. So generally, that's where the cases we see come from.
This latest case of drug-resistant tuberculosis comes while more than 100 medical professionals from throughout the Pacific are gathered at the Westin Hotel to discuss the growing number of tuberculosis cases in our region. Guam, for example, has 6 times the number of tuberculosis cases that Hawaii has, and 12 times more than the U.S. mainland. Among those attending the conference is Cecile Arciaga, the TB control manager at Guam's Department of Public Health.
One thing good with TB, it's curable. But one thing bad is that these germs are very arrogant. It takes time to kill them. So if you don't take the right medications the right way, the right time, you can develop drug-resistant strains or mutant strains that is resistant to the drug that is currently available.
Arciaga could not speak about the specifics of the current case at GMH, but she did say that public health officials take such cases of drug-resistant TB seriously, and patients who have developed resistance to drug treatment are monitored closely and placed under strict therapy guidelines.
Whether they're in the hospital or in the public health setting, is always a threat. Even if a patient is not drug resistant, it's always a threat, especially if they're not taking the right medications. That is the reason why the Department of Public Health has implemented what we call the Directly Observed Therapy Program, whereby a patient who is diagnosed or are suspected of having active TB and they're on medication, we actually observe these patients take their medications every day, no miss, and there's no exemption.
Kevin Kerrigan, PNC News.